So welcome to Better Life Chiropractic. We wanted to send you a video right after your examination so that you are more prepared to what to expect in the next visit. Just to kind of explain your examination, we find out as much about your past as we can, because even things that happen as childhood can create big problems in the future. You don't realize that your spine can actually be misaligned from a toboggan accident or a fall or something happened in childhood, let alone all the other things that happen in your life, and they've accumulated to where you are today. And so we're looking to find out how much damage is in your spine and how correctable this really is.
So the first portion of your examination, we had you standing up and we were looking at your posture. The reason for that is so that we can look for any sort of structural problems. Now, when I'm talking about a structural problem, and I'm just going to grab this spine here, what I'm talking about is when I'm looking at you from the front, I'm looking for maybe your shoulder, one shoulder being higher than the other. Your hips, maybe one hip is higher than the other. That tells me right there that there's some sort of structural problem going on there, and that your body is trying to compensate for that. Then when I look at the side, I'm looking for your head possibly being far forward, which can be causing choking to the spinal cord just by having the damage that's going on in there. Possibly your spine is flattened in the back. These are all things that we're looking for to see, okay, there is a structural problem going in there. The next thing we had you do is we had you lay down on the table, and we were pressing along your spine in here, and we were looking for misalignments in the spine and specifically functional problems. So as we're pressing along here, it shouldn't be painful. However, there may have been times when we pressed in there that you had some tender areas. This is where the damage is.
So the way we find out how much damage there is we take an x-ray. So this is a normal x-ray of a person's neck. The patient is facing this way to the left. And what we can see here are these nice, beautiful disc spaces and this nice C curve here in the spine. This is a really good example of what a normal x-ray should look like. So what we're going to be doing is comparing your x-rays to this x-ray, and we can see if there's how much damage there is in there. So the amount of damage that we find in your spine could determine how much pressure is on your nervous system and spinal cord.
After that, you'll notice that we did sensory testing, and this is really important to measure how much sensation loss is in your feet or in your hands. There are 7 different nerves that we're testing, and we need to get an idea how much sensory loss there is so that we can compare that with any further tests that we do down the road. The second test that we do is what's called a neuropulse exam, and what we do is we actually test the integrity of the blood system into the feet or into the hands. We also check their heart rate, and we also look at all sorts of different parameters so that we have a baseline of their overall health as well. We may have asked you to bring your spouse or bring a guest or bring someone who's very close to you. And the reason is we're going to be going through a lot of information that during the time that you're here. We're going to be going through your x-rays. We're going to be talking about your program of care if we feel we can help you. We're going to be talking about your financial arrangements. There's a lot we're going to be talking about, but what's really critical is that you have somebody with you that's not only a support person, but someone who understands what you're dealing with. So what's going to happen when you come in, you'll be welcomed at the front door, and one of the first things we're going to do is have you sit in an area where either Dr. Jasper, or Dr. Allison, or myself will be doing a general information so you know exactly what it is that not only we do here, how we do it, why we do it. After we're finished with the group portion, we're going to be bringing you into a room privately. That's where I'll go over your case privately with you and your spouse, significant other, or guest. And that's where I'll show you your x-rays, go through your tests, give you my recommendations. And I'll tell you exactly how long it should take, how many visits, any financial investment. We'll go through all of that and answer all your specific questions. So I'm really looking forward to seeing you and your guest or your spouse on your next visit, and we'll see you then.